Hello, my name is Taylor Holt, and I'm going to give a short presentation on how to start an IV. So I want to start off by saying that this skill should only be performed by those individuals with the right training and certification. Do not do this unless you have the right supervision and certification. This is to start an IV line and administer normal saline for a lack of fluid. That could be from any sort of trauma where you lose a lot of blood or similar situations. So first you want to gather all your necessary equipment. You want to make sure that you have your IV catheter and your administration set and your extension set. The IV catheter is what will actually be making entry into your skin. The administration set hooks up to the saline bag and connects to the hub that goes into your vein. The extension set is for the saline flush that you will see later. You also want a tourniquet to make sure you get good blood flow, gloves, and antiseptic wipes. You also want tape to secure the IV site. You can also use what's known as VenaGuard or Tegaderm. They're just clear stickers that you can put over the site. And then you also want your normal saline bag. That can come in any sizes from 250 milliliters to 500 milliliters to a full liter. You're also going to want your saline flush. That's in the top right there. That's what you'll connect your extension set to later to create your extensions or your saline lock, your sharps container where you will immediately put your catheter when you finish, and your chucks pad that goes underneath the arm to prevent any further mess. So to begin, you want to take standard precautions. So that includes gloves or any other form of protection that is necessary. That could be a mask or safety glasses. You're also going to want to explain the procedure to the patient. So that could mean you just tell them that you're going to put the catheter in their arm. You don't want to stress them out, so the more they know, the better. So you want to assemble your equipment. As I stated earlier, you're going to want to put your saline lock together, and that is your 10 cc saline flush with your extension set. Once you connect those, you want to push the syringe enough that there's no air bubbles in the extension set. You also want to prepare any tape that you want to use later so that you're not struggling when you're holding the IV down. And you're going to want to attach the administration set with the saline bag. So as you can see in that picture, there are two ports. One of those is a drug port and the other one is to put the administration set in. Choose the correct side, as that is important. Once you have that in, you can see in the picture that they're squeezing the drip chamber, and that just fills up the chamber a little bit so you can see the rate at which it's flowing. And then you also want to have your catheter prepared so that you aren't stressing out the patient. So as you can see in this video, here I'm about to apply the tourniquet and I have my gloves on. You want to make sure to avoid any rolling of the tourniquet. That makes it more painful for the patient. Here I'm palpating the vein. You want to avoid arteries. Those are hard. Those are dangerous if you hit them. And if you do, immediately withdraw the catheter. Here I'm using an aseptic technique, starting in a circle from the inside out. And you want to make sure that it's clean, and if your wipe comes away dirty, you want to do so again. In this video, I have the catheter in my hand. I made sure that the bevel side is up, and when you insert, you want to go in at a 45-degree angle, and then once you get flash, you level out to a 30-degree angle. Unfortunately, this is a training arm, and so there wasn't any blood, but you should be able to see the flash chamber is the clear part, and that would have blood fill up, assuming that you're in the vein. If you aren't in the vein, then no blood would show up. Once you have flash, you want to advance the catheter and lock the needle out so that it's safe. In this video, you release the tourniquet. It's kind of painful for the patient, so for patient comfort, you do that first. There, I immediately disposed of the sharps in the sharps container, which is out of the screen, but you want to make sure that you don't just leave that, in my case in the ambulance, on the ground, on a seat. You want to make sure that you dispose of that immediately to prevent any accidental sticks. See there, I'm holding, once I take it off, I'm holding what's called traction, and you want to make sure that you occlude the vein so that it doesn't bleed out while you're holding that. In this one, you attach the saline lock, and once that is attached, you can let go of the vein and the pressure you're putting on it. This is aspirating. If this was a real person, you would see blood come back through the saline flush to make sure that your IV is patent. And then when you push the solution, you want to watch the site for any swelling or infiltration. If you see any of that, withdraw it immediately and hold pressure. You want to secure it. I use tape this time. You want to be able to still maintain visualization of the site in case anything starts to change. And you make sure that once that's done, you can take off the saline lock here in a minute. So there, I've removed it, and I'm attaching the extension set, or the administration set, I apologize. This is just a twist turn. And then this administration set was already set up for you. And this is connected to the saline bag. See the drip chamber there? And then you adjust to the appropriate rate. If it's someone who has an extremely low blood pressure, there's medical math that you can do to determine what rate to administer at. Otherwise, you do what's called TKO, and that's just a slow drip so that it's a constant movement but not very fast. That's all I have for you today, and thank you.